Good afternoon, everyone, and welcome to this online meeting to call for a Community Neurorehabilitation Team for the Midlands and North East. My name is Mags Rogers. I'm the CEO with the Neurological Alliance of Ireland, the national umbrella of nearly 40 neurological charities throughout Ireland that provide services and supports people with neurological conditions and their families. I'm delighted to be joined today by people living with neurological conditions and by local service providers from across the Midlands and the North East to support our call for Community Neurorehabilitation Team. You're going to hear directly from them why it's vital that the promise made in 2019 to deliver a Community Neurorehabilitation Team for the Midlands and North East is finally delivered, to ensure that it's finally delivered in this year's budget. Teams in the south, west and east of Ireland are coming on board in 2025, but the Midlands and North East, the former CHO Area 8, still has not been funded for a Community Neurorehabilitation Team, despite such a team being promised since 2019. This represents a stark inequality for people with neurological conditions living in counties throughout Louth, Meath, Westmeath, Longford, Cavan, Monaghan, Laois and Offaly. A team was originally promised in 2019 and there is a clear commitment in the current programme for government to complete the rollout of community neurorehabilitation teams across the country, including in the Midlands and North East. I'd like to welcome the public representatives that have joined from the relevant local constituencies today. If anyone is in a representative role, please take a minute to type into the chat the person that you're representing in order that we have a full capture of the elected representatives today. Just to note that this meeting is being recorded and will be available afterwards on our social media channels. I want to hand over to our first speaker, Liam Lynch. Liam is living with an acquired brain injury and he's going to speak about the difference that it would have made to his journey if there was a local community neurorehabilitation team in County Meath, where Liam's from.
Hi everybody, my name is Liam Lynch and I live with an acquired brain injury. So my story is in 2017, I was doing something which I did quite often. I was doing a charity cycle. And towards the end of the charity cycle, I was knocked down by a car. And I spent 2 weeks in Tala Hospital. I've no memory of the accident. I lost my memory from about 50 minutes before the accident to almost 2 weeks after it. I remember the evening before I came home from hospital. I remember that in the hospital, but I have no other memory of my time in hospital either. So I came home with my leg in a cast and I spent almost 8 months at home. I wasn't able to go back to work at the time. I eventually went back to work after 8 months and I just wasn't able to do the job I had been doing, which was a little bit physical, not extremely physical, but a bit physical. And it was working around vehicles and I would have had to be climbing up on top of vehicles and getting underneath vehicles and stuff like that. And I just wasn't able to do that. So my employer put me in an office position, which was very good of them at the time. And after a while in the office position, I kind of knew that this wasn't going to last, this job that I was doing. I was tidying up stuff that hadn't been looked after in years and I knew it wasn't going to last. So I started to look around elsewhere. I had been unwell before my accident. I'd been bitten by a spider and I had been at home for a few weeks. And while I was there, I decided to register myself as a teacher. So I had taught in the past and I registered myself as a teacher. So now that I knew this job was not going to last, I started looking for teaching work. And I got a job in Dundalk teaching a PLC course. So I did that for a year. And during that year, I honestly thought I was losing my mind. I had severe difficulty with the job. Things like searching for stuff on the internet, I just couldn't do anymore. I was getting lost on the internet. I was getting lost in websites. Didn't understand what was going on. Just thought I was losing it. So before I switched jobs, I had been referred by my own GP to a neurologist in St. James's Hospital. because she wasn't happy with how I was. So she said she wanted to have me checked out by a neurologist. So I went to the neurologist and I was assessed. And he was to then send a report to my doctor. And I heard no more about that. And after the year in Dundalk, I decided I was going to take a break to try and get myself straightened out. So I didn't renew my contract. I decided to take at least a year off and then look for another contract. So while I was on that year off, I was called back into that psychologist for a routine follow-up. And while I was there, he asked me how I was, and I said, well, I'm actually quite good, but I have terrible trouble in work. So he asked me what kind of problems I was having. I gave him a quick explanation, and he just said to me, well, Liam, you have an acquired brain injury. You have to expect to experience problems like this. Now, that was the first time anybody had told me I had a brain injury. I had no idea. So I just said to him, well, what do you mean I have a brain injury? And he said, you have an acquired brain injury. So I said, but nobody ever told me that. So he suggested that maybe I had been told and I'd forgotten. I said, no, I wouldn't have forgotten that. So when he checked, he discovered that his office had never sent a report to my doctor. So I had spent a year not knowing what was wrong with me, thinking I was losing my mind, trying to go back to how I was before my accident, which I wasn't capable of doing because my brain operates differently. So for that year, I was just completely puzzled, just lost. I didn't know what was happening. So he then gave me the contact details for Acquired Brain Injury Ireland. And I contacted Sinead Crawley. And Sinead put me on to the group who were meeting regularly in Navan Library. So I started going there. And I've been going to acquired brain injury since. And they've come out to me at home and they've done some stuff for me, teach me how to cope with problems that I have, how to kind of work around things and make things a little bit less stressful. They've also taught me how to accept my brain injury and accept, as my own GP said, I need to get used to a new normal. So I've accepted that new normal now with the help of acquired brain injury. If there hadn't been a team and I had been referred to it, they would have known straight away that I had a brain injury. Even if I'd only just been sent to have a chat with them, they would have known straight away. So if that team had been there, I probably could have found out a lot sooner rather than spending almost 2 years with a brain injury and not knowing it. So that would have made my life very different because life is different. I feel I'm a different person. I have to do things very differently. And there's so many things I used to do that I can't do anymore. And that's how life is for someone with a brain injury. You just have to either accept it or I don't know what the alternative is, but I've accepted it and I manage it and I get on with it. That's my story.
Thank you so much, Liam. And as you say, such a different journey that you might have had. And as you say, you have coped incredibly well with the support that you've received from NEI member, Acquired Brain Injury Ireland, and we'll hear from them shortly. But just that you could have had that news and had that preparation for so much sooner if you'd had that direct discharge to a community neurorehabilitation team in your local area. Yeah. I'm going to move on to Dan. Dan is just going to share his experience again of stroke and the difference that a team having access to a local community neurorehabilitation would have made to him and to people throughout Meath.
Yeah, thanks very much. Can everyone hear me okay?
Yeah.
So in April of 2024, my story's not as good as Liam's. I was exercising and I burst an artery in the back of my neck, which then led to a stroke a few days later when the clot was forming in the artery. Luckily enough, I was in the hospital, so they had removed the clot in my brain within 4 or 5 hours. So I had that magic window. It couldn't have worked out better for me. I'm where I am now because of the intensive work that was done in the hospital. I said yes to absolutely everything. Everything that came to me, I said, yeah, I'll do that. Yeah, no problem. I was down with the physio, the occupational therapist, the whole lot. When I got discharged from the hospital, things were a lot different. It had felt like my safety net was gone. We didn't know what we were looking for. The first 2 or 3 months at home where it was exhausting. And for honestly, if it wasn't for my wife and that support network we had there, we wouldn't have found the resources that we did. Like if I was lacking in a certain area with physio and stuff, we found that ourselves. Now, thankfully, I've gotten referred to the speech and language therapist and the physio and the HSE, but I'm still on a waiting list for a lot of things from public services. And you don't know what you don't know. So where I think I'm functional, it's only when I try to do something that I'm like, oh no, I can't do that anymore. Which I've got two kids, 10 and 7, so I'm figuring that out every couple of weeks. And they ask me to do something I used to do, where now they're like, I can't do it, and they have to learn their patience. But we're learning that by ourselves for the first time, and then we're going to somebody else with questions. I can't imagine how hard that is to do it alone without somebody who has the expertise and the experience to be able to back that up and to know what they're looking for. So I think about this in terms of a physical thing, and I was trying to explain this last week. My mother had her hip replaced a few years ago, and she had left it go so long that they were picking out little bits and pieces of it, and that was fine. It got done. But I think about this in regards to brain injuries. You don't know what you don't know, and you miss that window to rebuild the pathways. So where I couldn't get out of bed the second time I woke up in ICU in April by myself, I had to be helped with everything. So walking out of hospital, that was because I was so stubborn about it. Like the physio in hospital said to me, "You're going to have to be stubborn," and she didn't know who she was talking to. Like when she said that to me, it was a great opportunity to say, "Yeah, okay," and I did absolutely everything I was told. And when we got home, the support network just wasn't there. We were looking for it. Now, I get a lot of support from the Irish Heart Foundation, Acquired Brain Injury Ireland, and I started with Headway. They're doing the government's work. The hospital's job is keep your heart beating fine. They're going to stop you dying, whatever. When you're out there, though, it's almost you're in a decline until you're brought back in. So having to wait until you get bad enough to access services it's not good enough. And we can't keep talking about doing this, and it sounds great and all that, but just do it. And throw whatever money is needed at it. I would believe that charities only exist where the government fails. And leaving such important work to a sector that has to fundraise for their own money is ridiculous. The amount of money that the Irish Heart Foundation, Acquired Brain Injury, and Headway Ireland, and the Neurological Alliance of Ireland are saving the government is unbelievable. Like, our job, or your jobs, should be to try and keep people out of hospital beds. And when you discharge people without the proper support network and rehab and recovery network, you're just waiting until they decline enough to bring them back in. Like, this is an opportunity in the Midlands now. If we got this in here, this is an opportunity to reduce the future need on our health system. I attended X-Well classes, and it was stark. Because when I was in there, I could see the issues that people are having in their older ages, like having trouble sitting down and standing up. We're obsessed with this kind of quality or quantity of life, and not quality. There is a backlog coming of issues that people will need to improve their quality of life. And if you think about the expression that justice delayed is justice denied, that's the same with healthcare. If you're delaying what people need, what the country needs, you are denying them the proper services. Yeah.
Thank you so much.
Like, sorry.
You put that extremely well, Dan. Thank you so much. And as you say, it is that missing tier of service. And I suppose one of the things that we really want to highlight this afternoon is that these teams are a reality in other parts of the country. There are 4 teams coming on board in other regions of Ireland in 2025. And the Midlands and North East really is a region that's been left behind because it hasn't been funded for a community neurorehabilitation team. There are a lot of people, as you can imagine, that just want to come in. I want to come to Sorka now. Sorka lives locally with MS, and she's very familiar with this issue. She has long campaigned for a community neurorehabilitation team for the Midlands and North East. Do you want to come in, Sorka?
Yeah, hi everyone. So I'm Sorka. I'm living in the middle of nowhere on the Louth-Monaghan border. I didn't have an acute situation like a stroke or...
If you can just turn your sound up slightly, Sorka. Sorry, you're just...
Oh, sorry.
Thank you.
Is that any better there? Is that
That's
better?
a bit better, yeah. Thank
Yeah,
you.
just, so I didn't have an acute situation like Dan and Liam. I was diagnosed with MS in 2014. A year after my diagnosis, I was already onto my third medication, and I had an enormous relapse where I spent 10 weeks in Beaumont Hospital as an inpatient. And then after that 10 weeks, I had another 8 weeks of inpatient treatment under the brain injury program in the NRH in Dunleary. So I have had that situation where I've been severely, acutely unwell and needed physiotherapy and speech and language therapy and occupational. I needed all of the therapies. And I always consider myself that I'm one of the lucky ones that got to go to the NRH. That was 9 years ago. So my MS did not calm down after that. And one thing, long saga came to another. I ended up going to London 3 years ago and I had a stem cell transplant to treat my MS. Now that has been transformational in a lot of ways, but I have a lot of damage to my walking and my mobility and my balance because of my MS. It's never going to fix itself. So I need physio, I need OT, I need all of the things that I should have access to, but because in the community it doesn't exist. So if I need it now, I have to go to the NRH, and even at that, I have to go on a 6 to 9 month waiting list for an outpatient appointment. It's not feasible. So I need help with my walking, with my mobility. I have a brain injury that I'm living with. I have problems with cognition, with my memory. I worked as a midwife, but because of my MS, had to stop working as a midwife. And I feel like we are the poor relations, like we just get put at the bottom of the queue all the time. And you know, in County Louth alone, we have the 2 largest towns in the country. And even neurological patients have to go to Beaumont or Vincent's or the Mater. You still have to leave County Louth just to see a neurologist. So you know, and I don't want to get to a point where the only access I have to specialist neuro is where I'm ill enough that I need to be hospitalized as an inpatient, because that's not the point. The whole point of this idea where they have this like living well with chronic illness in the community, you can't do that if you don't have the resources that are necessary. So it's all very well having physiotherapists in the community, but they're not neuro specialists. And if they're not neuro specialists, there's actually very little point to go and see them. I did see one about a year ago, and he said to me, I asked him about things to do with I had a certain amount of muscle atrophy in my right leg because I had worn a brace on my leg for years. I don't need the brace on my leg anymore, but he said, oh, you'll need to speak to a neurophysio about that. And I said, well, can you put me in touch with one? We don't have a CNRT in the community. You'll have to get in touch with the NRH. And that's where we are. And my transplant was 3 years ago. I've had no physio in 3 years. And I don't want to just have generic physio. I want to have specialized physio, because that's what you need to have with a neurological condition. There's no point having very generic physio. You need to have tailored, specialized physio to your own individual needs. And again, completely and utterly absent in the North East. And it's very galling to hear that other places are getting it. We're 6 years into this. Like, why is it taking so long? Why other places are able to get it together? But again, North East and Midlands, no, forget it. So like, again, if I need to have dedicated, specialized neurophysio, I can go to Beaumont, but again, that's a waiting list, or the NRH, which is an even longer waiting list. But that's traveling all the way to Dublin for a 40-minute consultation. There's no therapeutic benefit to that, because I'll just be tired by the time I get there from all the driving. And you know, so you know, I know there are local representatives here on the call. I don't understand how we can be funneling loads and loads of money into other projects. This is not a huge project compared to things like the National Children's Hospital. This is a relatively easy ask, particularly because other areas are starting to build their CNRTs. Why, in the name of all that is good and proper, have we been ignored in the North East and Midlands? That's my question for anyone. If there probably aren't any local reps, but if there are, I'd like an answer to that question, because there doesn't seem to be one. That's me, Mags. If you want me to say more, I will, but I'm conscious of time. So
Thank you, Sorka. Look, I really appreciate it. And I know you've been with us on this journey. You know, you sit on HSE groups as well. And it is that frustration. As I say, the teams are coming on board in other areas of the country, but we still don't have funding. It's not a question of recruitment. We still don't have funding for the promised community neurorehabilitation team for this region.
We can fund bike shelters though. We can fund those, no bother, like.
but we still don't have funding for a community team. And as I say, we have a commitment in the current programme for government. That is why the Neurological Alliance of Ireland is calling in this year's budget for 4 teams to be funded, including a team for this region. I know I want to bring in a local service provider. I want to bring in Kate Leonard here now from Acquired Brain Injury Ireland. And then I see lots of people wanting to come in, and I'm going to also open it up to our elected representatives to comment if they want to join. So Kate, I'll hand over to you.
Perfect, thanks Mags. Hi everyone, my name is Kate Leonard, working with Acquired Brain Injury Ireland as a local service and case manager. I just want to say thanks to Liam, Dan and Circa for sharing their stories there, very inspiring. And I know Liam has been an excellent advocate over the years for those living with an acquired brain injury. He's a perfect example of someone who's just slipped through the cracks. And sadly, Liam's case is one of many. As part of my role, I've seen so many cases where clients have been discharged from hospital back home with little to no support or follow-up. I was only recently out with a client who was in hospital for 6 months and very, very sick, discharged back home to be with her family, and has had no OT environmental assessment, no assistive aids put in place, and has been told that the wait list is up to 2 years before she'll even be seen. And that's just wrong. It's putting someone in an unsafe environment and really increasing the risk of them having a reoccurring accident and hospital stay and infection. And it's just unnecessary. If the CNRTs were in place, that just wouldn't happen. That person would have access to all of that support before even being discharged home. They'd be linking in with the MDT and making sure there was a clear plan for that transition home. And I think that piece is so important, that people are supported in that transition from hospital to home, and to make sure that people have the right healthcare providers going out to see them and support them. So I suppose for us, the introduction of the CNRTs will definitely bridge that gap, and it will create a clear pathway for the hospital to home, but also to access our services. And I know Dan spoke there, and I suppose even for Dan, I think he was referred into our services back in May 25 and only accessed them in January because the wait list for our service is so long. So in having the CNRTs get involved, there will be a 3-month period where Dan would have had that support, and then it would have been a smooth transition over to ourselves. And there wouldn't have been that gap there where there was absolutely no service. And that's what happened to Liam. There was no service for a long period of time, whereas if the CNRTs were involved, Liam would have been linked in with us, accessing our social club, our clubhouse, our community service, and would have had a really cohesive approach to his ongoing rehab. And that's the thing, rehabilitation is not just a one-off thing, it's for life. You need to work on maintaining that progress that you've made. And without accessing those services, you regress. It has serious impact on your mental health, your relationships. You're putting a burden on carers, and it's just, you see things break down. So it's so important to have that cohesive approach. And I think the need for investment in the CNRTs and long-term rehabilitation services needs to be a priority for government in order to provide that ongoing essential care for those who have survived a brain injury, and to give them that access and the right to rehab. I hope I covered everything.
Thank you so much, Kate. And I think you've built a really, really good picture there of how this is a pathway, and that the Community Neurorehabilitation Team is that really vital stepping stone to the long-term rehabilitation services. As you say, the Community Neurorehabilitation Teams are part of the picture, but they're a really essential part of the picture in order to get people, I suppose, as I say, that crucial stepping stone to long-term rehabilitation and people getting their lives back after acquired brain injury, or like people like Sorka already living in the community with progressive neurological conditions. I know people I just want to share briefly just an anecdote to show, I suppose, what a team can do. I spoke to a lady last week who was able to avail of the Community Neurorehabilitation Team that's up and running in the Midwest. This lady had sustained a stroke. She got a letter when she arrived home with a date for her to have an appointment with the local Community Neurorehabilitation Team. She had never heard of a Community Neurorehabilitation Team, but there was the letter when she arrived home with an appointment to meet with the Community Neurorehabilitation Team. As she says, she got all of her therapies in the one building, coordinated specialist physiotherapy, speech and language therapy, neuropsychology. She didn't have to, as Dan says, look around, hunt around for these services. There were no gaps because she was able to access that community neurorehabilitation team. And as I say, that is up and running in the Midwest for a number of years. It's coming on board in other parts of the country in the 2025, later in 2025. And we don't want to see a situation where there's an inequity and the Midlands and North East is left behind. So at this stage, I'm going to bring in some of our local NAI member organisations, and then I'm going to give an opportunity for any of the elected representatives. It's fantastic to see them on the call today for them to join in and comment. So I know that you've been waiting for a while, Caroline, so from PSPA Ireland, so I'm just going to bring you in here. Mute there, Caroline.
Sorry. Hi, can you hear me okay? Yeah, okay. Sorry, my name is Caroline Dooley Martin. I'm CEO of the Progressive Supranuclear Palsy Association of Ireland. And progressive supranuclear palsy is a very progressive condition. People lose the ability to walk, talk, see, swallow in a very short length of time. And the problem about not having access to these teams is that very often in this condition, shortly after diagnosis, some people will start to lose their voice and the voice will soften. And if that intervention isn't given at the particular time, the person will lose their voice ultimately. And that progression is very fast in some people. For instance, I spoke to somebody the other day who said, I could speak to my father 3 months ago, now I can't hear him at all. And the problem is there was no speech and language therapy available for that person. With the access to a speech and language therapist, the person will eventually lose their voice, but they will certainly maintain it for longer. The other aspect of it is that as the voice is being lost in this condition, they also lose the ability to swallow. So if you're minding somebody at home who's not getting any therapy and they're losing their swallow, they're choking all the time. And this is a very difficult situation for people to be at home, knowing they can do nothing to support the person. So the neuro-rehabilitation team's access to them in the community is vital, but also access on time is significant in progressive conditions. There is also, with the condition, the increased risk of chest infection, which comes with swallow difficulties. And that leads to pneumonia, which is usually a killer in this condition. So there is no quality of life for the person. So access to neuro-rehabilitation teams help to improve the quality of life, particularly in conditions that have no treatment or cure. And not only that, you have balance issues. And people in this condition fall backwards all the time, which is very unusual but common. But because it shares symptoms with other conditions, it often gets misdiagnosed. And so if the people aren't aware of it, they may not get the access to the team in time. And as a result of that, they move very quickly from being able to walk to a wheelchair. And that itself has many complications. And after that, the system starts to fail. And it is very, very difficult when there's no supports locally for these people. We have a lady in one part of the country, and this isn't uncommon in areas where there are no supports, where you have somebody who may be in their late 60s or 70s, and they have to get up at night to bring somebody to the bathroom because there's no aids available to help them get the person to the bathroom and back again. Or somebody who has to come to Dublin for an appointment and they haven't the transportation to get to that appointment, and nobody locally. So as a result of that, they have to push a wheelchair and probably in a lot of cases don't have transport. That person I know an individual who has to push her wheelchair and she says, I can hardly push it up the hill. I have to push that wheelchair to get to the local train station, and then I have to get a Lewis, and then I have to go to my appointment, and then I won't see them for months. And at this stage, I'm at home watching my husband slowly fading away. And I think this is why it's really important to have the community rehabilitation teams locally and available, because otherwise all you're talking about in a progressive condition like this is quality of life, and you cannot give a person quality of life if you have no teams there. So essentially you're giving them a death sentence. So that's all I have to say. And I would just like to say that it's vitally important to support the Neurological Alliance in their endeavours continually to support people with neurological conditions in Ireland. Thank you.
Thank you so much, Caroline. And as you know, you echoed that point made by Dan earlier, these teams are saving money by having these teams in place. It's keeping people well in the communities. These teams are Sláinte Care in action. So it really makes sense on so many levels to be funding these teams, putting them in place. I'm just looking now. Jennifer, do you want to come in there?
Yes, thanks, Mags and NAI, and thanks to those who shared their stories, and thanks to the public representatives who are here. So I'm Jennifer Edgeworth, Dr. Jennifer Edgeworth. I'm the principal, interim principal psychology manager in Longford Westmeath. Prior to taking on this job, I was in a role that's very relevant to what we're talking about. It's called Link. It was a role that I developed myself through a Sláinte Care. So I think it's quite timely that Mags just mentions Sláinte Care there, because I suppose it was a Sláinte Care initiative asking people on the front line to devise services that were really needed. So my idea was a service for people with stroke and dementia in County Longford and Westmeath, and it was going to be an integrated care post. So the idea was, which seemed to be quite radical, funnily enough, was that I could follow, as the neuropsychologist, follow a person on their journey, regardless of whether they're in hospital, in a rehab unit, or at home. So I was awarded the funding and I was audited, and the service was mainstreamed in Longford since 2020. So I suppose I was referred, because it was only me, I had to, I suppose put strong boundaries on what I could do. So it was for people over 60. So I've been, I suppose, getting about over 100 referrals a year, just to me. And then as time has gone on, I've had to be a little bit more relaxed, because, as everybody's pointing out, there isn't a service available for people. So I've had to start seeing people who are a bit younger and who don't have just stroke and dementia. So I've been getting referrals for people with Parkinson's, acquired brain injury, and so on. So I suppose the service is really, really important. It's really vital. Link has shown that it can work, it does work. I suppose when I'm working in the hospital, it's quite easy for me to tap into the other disciplines, the speech therapists, the occupational therapists, and so on. When I follow people into the community, I, as well as they, are at sea as to, where we can get services. So some of my work is about signposting, trying to find an OT, trying to find a speech therapist, and often those disciplines always, I would say almost always, those disciplines have, I suppose, different waiting times. So it's very difficult for people in the community. Psychology is important, but it's only as important as being able to work with other colleagues. So I'm hoping that we will have a community neuro rehab team in this area. It's really important. And I suppose the other thing I would say, and I've been banging on this drum for a long time, not everybody needs to go to Dublin for everything. We should have these services in our local area, right place, right time. So thank you very much, and let's hope we get some progress out of this. Thank you.
Thank you, Jennifer. And as you say, you make a very good point. This is government policy to deliver these community neurorehabilitation teams, and they are coming on board in other areas of the country. And what we do not want to see, to reiterate again, is that the Midlands and North East is left behind when there was a commitment to establish a team. I'll bring you in there, Eamon, and then I'll open it up to some of our elected representatives who want to join in and comment.
Thanks, Mags. I'll be very quick. Just want to thank again all those lived experience representatives that have shared their experience. Sorry, it's a wee bit late. Obviously, I've met Liam before in Leinster House. I know Circa well. Dan, I haven't met you before. So just for those that don't know me, my name is Eamon McPartlin. I'm the founder of F&D Ireland, which is a new support organisation for those living with functional neurological disorder, a condition I live with myself, along with another neurological condition called dystonia. And I just want to give two quick examples. We're a very new organisation, so we have limited support services, but one thing that we have rolled out is in-person peer support meetings around the country, which we run in the North East and the Midlands. And I suppose just two short stories just in relation to people that would attend those meetings. So an example there, we had Jennifer mentioned there, Longford. We would have a young lady that basically lives with FND, has just turned 19. So psychology support can be very important for those with FND. It's not the only intervention. We just want to make that clear. Multidisciplinary treatment is the gold standard. But this young lady was able to get that support through the CAMS. But once she moved out the CAMS system, it was not possible to get any psychology support at all. And I think it's very important to highlight that neurological conditions affect young people, not just old people. So the other example I have, which I see Lillian here from Erin's office, is a young lady that's a little bit older, in her late 20s, in Drogheda, who lives with very complex FND. And the complexity of this FND is that she's paralysed in 3 limbs, permanently tube fed, has several functional seizures, and has just recently lost her speech. She, unfortunately, like so many people, young people left with FND, has to fundraise to go to the UK for specialist treatment because they can't get access to neuro-rehabilitation hospital, and there's no community neuro-rehab team, obviously, in the northwest or the northeast. So this is why getting these community neuro-rehab teams are so important, not just for local access, but for access at all for some people with neurological conditions. Like many people with neurological conditions do not get access to the National Rehabilitation Hospital or to the Tier 2 rehabilitation centres in Dublin. They're not within the catchment area, or their condition does not fit the criteria for access. So I think it's very important that these community neurorehabilitation teams are rolled out everywhere as soon as possible, that people, as was mentioned there, I think by Circa and a few people, quality of life is the key, and early intervention is so important, as Caroline mentioned that. The longer you live with any neurological condition without intervention, the more difficult it is to rehab. And that's the challenge we have in the country at the moment. So many people are waiting years, as was mentioned there, just to get single appointments for different disciplines, not even multidisciplinary teams. So just to say well done to Mags and the team. This is such an important issue, and it's great to see a number of elected representatives on the call. Thanks.
Thank you so much, Eamon, and thank you for giving those local examples and just drawing attention to those really important issues, including that access to psychology, access to therapies, and just saying, there's these teams, as I say, they tick all of the boxes in terms of what we know is best for health policy. It's early intervention, it's available close to home. And as I say, these teams are up and running in other parts of the country, and they have been promised for the Midlands and North East, but not delivered to date. I see a number of our local elected representatives from this region on the call. I'd just like to invite them if they want to make a comment or ask any questions.
Hi, Tony McCormick here, TD in Offaly. Look, listen, thank you very much for everybody for their contribution this morning. It's an eye-opener for me. I didn't realise this was going on. Absolutely, I believe that these teams need to be in place. And I will, along with my colleagues, and as you said yourself, it's part of the programme of government that we make sure that this happens. I will, along with my colleagues in government, push this to get it expedited as quick as possible. So you have my support 100%.
Thank you, Deputy McCormick. And as I say, this is a commitment in the programme for government. So we're just looking really for delivery of what has been promised. And just to say, down in your own region, NEI would have campaigned last year for consultant neurology, successfully campaigned for consultant neurologist services for Portlaoise Hospital. Because we recognise that, as Jennifer says, everything can't be in Dublin. And really, there are people outside Dublin that critically need access to services. And sometimes it's the last place that services get delivered. Senator Tully, you wanted to come in there.
Thank you, Mags, and good to see you again. And look, thank you everybody for sharing their experiences. Some of you I have heard before, both in the Committee on Disability or in the AV room. So, and I know this around this, what this issue is about. I've spoken to you, Mags, and the 2 others around it. and how important these teams are. And I've spoken to many people who have an acquired brain injury due to accident or illness, or require neurological services. And they all talk about the wonderful care they get in our hospitals, especially in the NRH, and then they come home and it's like a cliff edge. There's no support there, and then they see regression, which generally often leads to depression and mental health issues as well, as the physical issues. So just a question, Max. I mean, you say Midlands, North East. How many counties specifically are you talking about? And then, is one team sufficient to cover that? As you said, it's not the recruitment that's the issue; it's the funding. So, and the teams that are established in other areas, are they fully staffed at this stage and working well, or are there still, is there still more work to be done on those? Thank you.
Thank you, Senator Tully. So I'll send you some more information by email, but I'll just reply briefly to what you're saying there. So in terms of the counties that we're looking at basically the former CHO 8 region. So that, and again, that would include, with the new reconfiguration of the HSE, the counties that are now coming into our remit for a team that aren't served by teams in other areas, would be your own Cavan, Monaghan, Laois, Offaly, Louth, Weed, Westmeath, Longford. And as you say, that is a huge region. So there probably is a need for an additional team. At the moment, with the HSE reconfiguration, I suppose they're still making that final decision of what team will serve where. And there is a possibility that there may be more than one team required. But as I say, even as a starting point, we critically need that team for the Midlands North East region to be delivered. It has been promised since 2019. So we could at least start with an existing team, and then if additional resources are needed later on, because there is a commitment in the action plan for disability services to have a team of 12 for each of the community neurorehabilitation teams, and increase that to 18, to a staff of 18. To reply to your question there around our teams up and running, there is a team in the Midwest that's been up and running for over a decade. There are 4 teams due to come on board in the South, in the West, and in 2 areas of Dublin, Kildare and West Wicklow. They're due to come on board later in 2025. So that leaves 4 regions of the country where there are no community neurorehabilitation teams. And that's what we're asking to be, that inequity, we're asking that to be addressed in the upcoming budget, in line with that direct commitment in the programme for government to complete the rollout of community neurorehabilitation teams. Hopefully I've answered your questions, but I say I'm going to pop you an email just straight after the call today, just with a little bit more detail on this area. And I know you've been a long supporter of this issue, and you've supported every time it's come up in the past. So we're delighted with your ongoing support for this in the Shannon in your role. Deputy O'Rourke, do you want to come in there?
Thanks, Mags, and thanks to everyone who spoke this morning, or this afternoon. It's a really helpful oversight, and like Pauline, I've heard you before, Mags, and tried to raise this issue as often as I can, and share the information with you. I think it's clear that there is a significant hurdle to clear to get this investment into the region, and for my part, I'll continue to raise it and try and push government in that direction. One of the things, and I see there's government and opposition representatives here, it might be an idea, for example, if in Meath we tabled a topical issue and raised the issue cross party. I know there's ministers maybe who mightn't have that opportunity, but I see Aisling and my colleague Johnny Gork, I'm sure would be happy to do that. I'm sure Aisling probably would be the same. She can come in, but just again in terms of trying to use every available opportunity to raise these issues. I don't know if there's an indication of where a service might go if it was in the region, but as you say, Mags, if we had that service for a start, it would be something. So just to say on my own behalf that I will continue to raise and push at it by written questions, and also oral questions when we get them. There's a lottery system associated with that, but a topical issue, joint cross-party topical issue on a county-by-county basis might be a useful approach as well. Thanks.
Thank you, Deputy Rourke. And I say, thank you for your support. You supported this before, and I suppose we're back here again, because we do see this region being left behind. As I said, there are 4 teams coming on board in other areas of the country. So this area is been actioned, but it's just not been actioned in this region. And it is an inequity that we do want addressed in this upcoming budget. So I really appreciate your support. Deputy Dempsey, do you want to come in? You've been waiting a while.
Yes. And thank you very much. Aisling Dempsey is my name, first time TD here in Meath West. And I met you previously in the AV room, which was, a real eye opener. It was actually one of the first briefings I'd been at, and very moving. It's great to see Liam there again. He's a constituent in Meath West here. So look, as Tony said, and as you've put it, you're only looking for what has been promised in that programme for government. And I like Darren's suggestion, across party sometimes is what's needed to really push things along. We need to be very vocal, government or opposition. We don't we don't need to play politics with this. It's something that needs to be delivered on. It needs to be gotten across the line as TDs together. So fully committed to doing that here in Meath West with the other TDs who may not be on today. But I'm actually sorry, Darren is probably right. Meath West and Meath East would be even better coming together on it, a stronger voice. So I'm certainly committed to doing that. Thank you very much.
Thank you so much, and nice to see you again. I remember you in the AV room, and to say that it was such an introduction for the first time to this area, but we really welcome and welcome your support. And as I say, it is great to see the cooperation on this issue, and just the efforts of elected representatives. As I say, I'll be in touch with all of you. And people who weren't able to attend today, as I say, I've just popped into the chat there. A number of people have offered one-to-one meetings with us, but we'll be in touch with further information following on from today. And we'll be sending an invite shortly for the launch of our pre-budget submission in June, which all of you are welcome to attend. And again, which will reiterate this call for funding for the 4 community neurorehabilitation teams in order to complete that rollout in line with the commitment to the programme for government. Deputy Smith, another long-standing supporter of this issue, thank you for joining us, and I just invite you to comment.
Yeah, thanks very much, Mags. And like the other speakers, I want to compliment the people who give us their own experiences. It's never easy to go and speak to other people about what you've been living through and the difficulties and the particular challenges as well. Look, continue to my full support, and we can obviously all work across party. I will raise this matter within our own party, the Fianna Fáil Parliamentary Party. I'll also raise directly through parliamentary questions, as Darren mentioned, that we have the facility through written and oral parliamentary questions and other Dáil debates as well. I'll raise this very, very important issue with the Minister for Health, and also directly in correspondence with the HSE as well. I think it was Jennifer mentioned that when she works out of the hospital, some of the other services are available more easily than through the community. When we get this particular team operational, will the lead come from a hospital, or who takes the lead, or where is the central point in the delivery of these services? Because as we all know, we're across a number of community health regions, the affected counties. So what would be the likely structure? Who would take the lead? Will there be one particular hospital take the lead in regard to the provision of services or whatever? But look at all, I'm not going to repeat what has been said. Everything is extremely valid, and I'd be glad to support as strongly as I can the necessity to have this essential service and services in place for people as soon as possible. And thanks, Mags, for the correspondence you send to us and inform us about on an ongoing basis.
Thank you, Deputy Smith. And I suppose just to say that these teams, where they are in place and they're working really, really well in other parts of the country, they are that hub for the community. So people can be referred in if they're living in the community already, as Sorka has, in Sorka's own experience. As I say, she's not someone in terms of being discharged from hospital, she's already living in the community with MS, she could access a team through self-referral if it was available in the Northeast where she lives. But also that hospital services, a variety of local hospitals would be able to refer in to a community neurorehabilitation team. So it is a resource for the entire community. It's a resource for local GPs. Local primary care staff can refer into a community neurorehabilitation team. And we've heard throughout this afternoon how that makes so much of a difference, that people can access those specialist therapies and can access them when they need them and where they need them. Olivia, I'll bring you in there.
Hello everybody, my name is Olivia Shiel and I'm from Drogheda in County Louth. I live with a spinal cord injury as a result of that grew my spinal cord, and I spent 13 weeks in Beaumont and then waited for my case in the National Rehabilitation Hospital. And like everybody else has said, my lived experience has been that once you leave the bubble of the NRH, you literally are left to your own devices, scrabbling, trying to keep yourself well, and it's completely the patient's burden rather than any sort of supports community-wise. So I have the exact same experience of everybody else, but just while everybody, all the parties and politicians representatives are here, I'm just wondering, is it possible that you could coordinate and cooperate together to represent what is it's a massive population base. If you look at the counties that are involved, two of the largest counties in Ireland, even all of the counties that you've mentioned there, are all within the commuter belt of Dublin. So why is such a huge population base not being given the funding, whereas other areas of the country are? Like, there's not one person who's attended this meeting that doesn't know somebody who has had a stroke, will have a stroke, tumours in spinal cords, tumours on the brain, all sorts of neurological conditions. I'm only mentioning a few, but there isn't one person here that will not have somebody in their family who needs these services now or will need these services in the future. So I'm just at a loss of why all parties within this region cannot cooperate together and put parliamentary questions on your constituents' behalf for us, the people who are living here and desperately need these services.
Thank you so much, Olivia. And I think you've drawn attention to a really vital point, which is that geographic inequity, that we're seeing the same regions again and again left out of the picture. And you say this is a huge arc running throughout that commuter belt, the Northeast, Midlands. We hear again and again of services for people not with neurological conditions not being available in this region. Just last year, we campaigned on that whole area of regional access to neurology services, and now we're looking at access to neuro-rehabilitation services. These teams are coming on board in other areas of the country, but they're not coming on board in the Midlands and North East. And I completely take on board what people have been saying this afternoon, but that's so many counties. Where is this team going to be? We really need to get a foot on the ladder for this region in terms of community neuro-rehabilitation. When a team is established and a team is in place, it will highlight the deficits in other counties, and will make the case for a bigger or larger team, individual teams, whatever is needed. But we really need to address the fact that a team was promised in 2019 for this region and it hasn't been delivered yet, even though at the same time teams are promised for other areas of the country and they are being delivered. Sorka, do you want to come in there again just before I let people go?
Yeah, I'm just going to, I was going to make the point that you made, Mags, that if there was a CNRT that there could be self-referral. I was in hospital 2 weeks ago, nothing to do with MS or neurological thing, but the waiting lists for anything, even for outpatient appointments, is absolutely ridiculous. So even if you're in hospital and they refer you, even if you're in with a neurological issue, there's still a long waiting list. And the whole point of these CNRTs is that keeping people well in the community means they don't need to end up in hospital. Like, it's an absolute no-brainer from my point of view. Like, this is the thing that will stop neurological patients ending up in hospital. I was in hospital. There was nothing to do with my neurological condition, but there was a number of people in the waiting room, and of course, there's no such thing as privacy in A&E. You hear all of their business, and some of them are in there because There was one person who had MS, another person who had Parkinson's, all looking for a bed because there's nowhere else for them to go. And it's absolutely outrageous that that's the only place that we can go when our neurological condition is flaring up, that we have to go. I sat in A&E for 22 hours before I got even a trolley. 22 hours sitting there. And that's just me, and I wasn't as unwell as other people. But the neurological patients shouldn't have to run the gauntlet of A&E when they may not end up there in the first place if they had access to CNRTs. Like, it really is a no-brainer.
That's a fantastic point to end the discussion on, Sorcha. As I said, this anyone who's familiar with health policy in Ireland knows the same things come up over and over again: trolley waits, lack of services in the community, and this is a really clear example of where this is working well and is being rolled out in other areas of the country, but is not available in this region. So as I say, I'd like to sincerely thank Dan, Sorcha, and Liam for sharing their personal experience today, and for the NAI member organisations. NAI makes up nearly 40 national neurological charities, and we heard some of their voices here this afternoon. We will be in touch with all of the elected representatives, both those who are able to attend the call this afternoon and those who have agreed to meet us one-to-one. We'll be in touch with them with further information. As I say, when our pre-budget submission is published in the coming weeks, it will call for 4 community neurorehabilitation teams to deliver on that commitment within the programme for government. So I'd like to thank you all so much for your input and for your support this afternoon. Thank you.